Patient readmission is a widespread issue that requires a robust solution. In the United States Medicare program, 19.6% of patients discharged were readmitted within 30 days, and 34% were readmitted within 90 days, costing a startling $17.4 billion annually. What were the reasons behind high readmission rates? Adverse drug events, confusion about post-discharge treatment plans, missed follow-up appointments were all common causes of readmission, all of which are completely avoidable. We set out to design a solution that could encourage patients to feel more involved in their care process, a comfortable platform to have their questions and queries answered, and enable them to proactively take up their post-discharge duties. This would help in building deeper patient-provider relationships, resulting in better public health in the long run. During our research, we learned that active patient participation in post-discharge care requires an ecosystem that facilitates a feeling of trust and easy communication amongst all three participants, that is, the patient, clinician, and admin. The vulnerable patient, who wants to be in charge of his health but lacks the means. The overburdened clinician, who wants to help all her patients but can't find the time. And the highly committed admin, who wants to keep patient satisfaction high but can't seem to. Going through the patient journey, it was apparent that most of the quick readmissions to the hospital appeared to be avoidable, yet represented a major scare for the patient. There was no single system that kept patients engaged throughout their healthcare journey and flagged important cases for clinicians so that they could take timely action with confidence. The answer: a centralized digital platform that brings together all participants involved in post-discharge care. A platform that engages and supports patients throughout their healthcare journey. When a patient gets discharged from the hospital, getting the right care afterwards is crucial to avoid readmission. The Smart Assistant fills the communication gap to connect all participants in the ecosystem: the healthcare institutes, patients, and care providers. The hospital admin uses the Smart Assistant to monitor the number of active patients and the overall patient engagement score for each flow. They can drill down to see a quick overview of any given workflow and tweak the modalities if the engagement score is poor. They can further analyze the engagement score by drilling down to individual patient levels. Based on the workflows configured, the patients are automatically enrolled to receive relevant and meaningful post-discharge follow-ups. The NLP-powered Smart Assistant bot reaches out to the patient with a simple text that contains a secure link to trigger the chat, allowing patients to actively engage in their care. NLP is crucial to understanding and responding accurately to thousands of unstructured patient responses and allowing patients to participate in their post-discharge care journey using their own words and preferred channels. It picks up on alarming terms to take the right action and sends an alert to the clinician. Alerts like these enable clinicians to make informed decisions and take timely action. The patient list appears in a prioritized queue. The clinician has manual control to decide which alert they want to act on versus ignore. Based on the alert, the clinician can get into the chat history to further understand the alert and build context. Furthermore, they can access a snapshot of the patient's journey presented as a timeline, helping the clinician to make meaningful conversation with patients when they reach out. Each data point is carefully chosen in the UI to reduce the cognitive load and make the clinician's life easier. This improves patient care quality, fills knowledge gaps, and reduces the manual workload on clinical staff. With patients becoming more informed and starting to feel like a part of the care team, they become comfortable in asking questions, raising their concerns, and proactively taking up their post-discharge duties. The Smart Assistant helped in closing knowledge gaps and ensuring patients are well informed, which was crucial to avoiding costly readmissions. This Smart Assistant helped in closing knowledge gaps and ensuring patients are well informed, which was crucial to avoiding costly readmissions.